Hello everyone, I'm Rikta. Welcome back to Medicine Nursing. So as you already know that Anatomy of Female Reproductive Systems session is going. In continuations with that, again we are here today for the discussions of another internal genital organs. So before we dive into today's sessions, let's quickly recall what we have covered so far. So we have discussed in part 1 regarding the different category of all female reproductive tract, that is your external genital tract, internal genital tract and your accessory organs. In part 1 we have briefly discussed regarding the external genital organs and we have enlisted mons pubis, labia majora, labia minora, clitoris, vestibule. We told that this vestibule consists of total 6 opening, one urethral opening, one paraurethral glands, one introitus and one bulbourethral glands. Then from part 2 onwards we started with this internal genital organs and we are still continuing this. In part 2 of internal genital organs we have leveled the different parts of internal genital organs like your ovary, fallopian tube, uterus, cervix, vagina, and we have briefly discussed regarding the ovary in part 2 like its location, shape, size, weight, its parts like outer cortex and internal medulla, its functions, the ligaments attached with the ovaries and the clinical relevance like ovarian cyst, then PCOD, PCOS and ovarian cancer. Then coming to the part 3 where we have discussed briefly regarding the fallopian tubes, its parts and the surface of fallopian tube, the cilium, its functions, the unique identified structure like the peg cells attached in these fallopian tubes and the different parts of fallopian tubes, its unique characteristics, the clinical concepts like salpingitis, salpingectomy, salpingo-oophorectomy, etc. So we explored the structure and functions of those fallopian tubes. Now let's move forward to understand the next part, and that is your uterus. So coming to this uterus, and I have drawn these pictures like this is your uterus and how it is situated or located with this vagina and cervix. Like the normal uterus position, okay, is anteverted and anteflex positions, normal positions of the uterus. Now what is this anteverted and anteflex? Well, I will show you one picture. Like let's paste this picture here. Okay, now see, this is your uterus. This portion is your uterus and it is attached with the vagina. And how it is located, somewhat it is bending, and this is your abdomen portion and this is the back portion of back portions of mother's body. Okay, so this uterus is bending towards the abdomen or towards the pubic symphysis, and that's the meaning of this your anteverted or anteversion. So anteversion means uterus is tilted forward and it's pointing towards your abdomen, okay, pointing towards pubic symphysis, we can say, or towards abdomen. Okay, now this anteflexion also somewhat meaning the same, it is bending towards your cervix, okay, towards cervix it is bending. So this anteverted and anteflex both meaning that this uterus is located like normal position is bending towards the abdomen and with the cervix. Okay, now this is your uterus this is your cervix, and this is your vagina. So here is this vagina. Now here is two angle. Sometimes questions come like this: which one is anteflexion, which one is anteverted angle, and which one is anteflex angle. Now this one and this I will mark it as 2. Now coming to this 1, this angle is called angle of anteversion, and this angle, this 2, is called angle of anteflexion. Okay, now how will you remember? Anteversion means between cervix or vagina, or between uterus or cervix. Okay, now this anteversion, this V is associated with both for version, both for vagina, along with your cervix. V is there. So anteversion means it is between cervix and vagina. Okay, where both V letter is there in cervix and vagina. Now in case of anteflexion, there is no V. So in uterus also there is no V, but in cervix it is V is there. But you have to remember, like the tricks will be, anteversion V is there, and cervix and vagina, between cervix and vagina V letter is there. So anteversion means between cervix and vagina, and anteflexion means between uterus and cervix. So anteversion angle is less than 90 degree, and anteflexion angle is less than 120 degree. That's what you need to remember from this. Okay, and this is the concept of your anteversion and anteflexion. Now coming to this is one important things, like how will you remember? You need to remember the weight of this uterus during your non-pregnant stage. The weight will be approximately 60 to 80 grams, and this is important actually. Many times this MCQ come from this non-pregnant uterus weight 60 to 80 gram, and both for pregnant and puerperium period this is 1000 grams, and here also this is 1000 grams. Both non-pregnant stage and puerperium stage it is 1000 gram. And capacity in non-pregnant stage, its capacity will be like 10 ml approximately, but in pregnant stage it is from 5 liter to 20 liter maximum. And in case of puerperium period, slowly it is reducing, and the capacity will be approximately 5 liter. Okay, so you have to remember these things. Weight and capacity of the uterus in non-pregnant stage, in pregnant stage, and in your puerperium stage. Now coming to your, so when a mother will get pregnant, slowly its bulkiness will get increased, and from 60 to 80 gram it will reaches up to 1000 grams. Okay, after the delivery of the baby, then this during your puerperium stage, this uterus size will get reduced, and after 6 weeks of your puerperium period it will become like non-pregnant stage, this shape, size, length, breadth, etc. Okay, now coming to the different parts of your uterus. So the parts of the uterus, here we will mark it as, this is the fundus portion. Okay, this is the cavity or body of the uterus, Okay, in this portion, this angle of this uterus, here it is called cornua, and this is also one important parts of this uterus. Now this is your isthmus, the lower part of your uterus is isthmus. This hole like structure, this is called internal os, and this one is your cervix. Okay, we will discuss one by one the different parts of the cervix and the 3 layers attached in this uterus. It is also very important from inner to outer, innermost layer, inner to outer I am discussing. So inside the uterus, the innermost layer is your endometrium. Okay. Then second one, the middle portion is called myometrium, and very strong layer. Okay, this is the middle part. And the third, that is outermost portion, is called your perimetrium. Perimetrium or your serosa. Okay, this is the outer layer. So this is the layer of the uterus. Now there is another one important concept, like what is living ligature. So living ligature means, as you already know, uterus has total three layers. Uterus has 3 layers. Okay. Now when the mother gets pregnant, then all the layer will increase its length, volume, etc. Okay, so not only the whole uterus will get increase, bulkiness will get increase, along with that this myometrium portion also get increase. Okay, in that myometrium all the fiber will increase the number of fibers and the blood vessels, etc. Even this myometrium will be having the 3 layers during the non-pregnant stage. So how will you remember? This outer layer of the myometrium will be longitudinal in nature, and the inner one will be circular, and the middle one is mesh-like structure. Okay, mesh-like structure. So outer O is there, here also O, inner I is there, here also I. So inner is circular, outer is longitudinal, the fiber, and middle is mesh-like structure. Okay, now all this layer also, fibers also get increased. So after the delivery of the baby, you heard about the PPH. Okay, so bleeding will be there in uterus, and this postpartum hemorrhage, PPH chances are there. So that time when the delivery of the baby will already happen, this uterus will get contracted. Okay, uterus contracts. So if uterus contracts, then this myometrium also get contracts, right? Myometrium gets contracted. So whatever blood vessels are there, it will also gets contracted, right? Contracted too. As a result, if blood vessels gets contracted, means it will get squeezed and bleeding will stop. So that's why it is called living ligature. Hence we call it as living ligature. Okay, so sometimes questions will come, living ligature, and it is associated with your myometrium. Now the main things, that is the different parts of your uterus. So as I already discussed, let's level it as the first part, that is cornua, second part is fundus, third part is body of the uterus, and fourth part is isthmus. So let's discuss about the cornua. Okay, that is cornua. So what things you need to remember from this cornua portion? So this is the entry point of uterine cavity. Okay, and here this is situated the upper lateral angles. Okay, upper lateral angles of uterus called your cornua. And this is the main important characteristics. It's called, this cornua is called pacemaker of contraction. From here this contraction started. Okay, and 3 structure as attached here in this cornua, and that is anterior to posterior, total 3 structure is attached, that is round ligament, then your fallopian tube, and your ovarian ligament. So that's all you need to remember from this cornua. Cornua is the entry point of uterine cavity, and the upper lateral angle of the uterus is called cornua. This is the pacemaker of contraction, because from here contraction started, and three structure like your round ligament, fallopian tube and ovarian ligament is attached with this cornua. Now coming to the second part, and that is your what? Fundus. Okay, fundus of uterus. So what things you need to remember from this fundus is that it is dome shaped structure. Dome shaped structure. Where it is situated? It is situated above the uterus, means most top portions of the uterus. Okay. Along with that, it is situated above the cornua. Let's check once. Here this is your fundus, and it is situated in the top portions. Okay, here it is the top portions of the uterus, and it is the cornua, so it is situated above the cornua. So that is your fundus of the uterus. And another one thing you need to remember, normally it is dome shaped, but few women this is the normal uterus shape, right? But for some few women this is like flattened like structure will be there, means for them this fundus portions is not dome like structure, and we will call it as what? Arcuate of uterus. Arcuate of uterus. That means it is the fundus portion is flat. If it is dimple, if there will be dimple, like somewhat it is like this. This is your normal uterus. If this is dimple like structure, then also we will call it as arcuate of uterus, flat or dimple. Okay, so that's all about your fundus of the uterus. Now coming to the body, third part is your body of uterus. Body means that is corpus region. So what things you need to remember from this body of the uterus? This is the main, this is your body. This is the main part of this major portions of this uterus. Okay, so this body is the center part. Okay, central part of uterus, and it is thick muscular wall. Okay, and it is lined by endometrium. Another one thing you need to remember from this, like the shape is like inverted triangle. Okay, if this is fundus, and if sorry, so see, this is inverted triangle, right? So this is the body of the uterus. Okay, and uterine cavity is present here. Uterine cavity is present here. So that's all you need to remember from this body of the uterus. Now coming to the fourth portion, and that is your isthmus. Okay, isthmus portion, from here you need to remember only this is the narrow portion, narrow or constricted part between body of uterus and cervix. So let's check. here it is your isthmus. So it is situated between, this is the body of the uterus, and here is your cervix. So it is situated between the body of the uterus and your cervix. Okay, sorry. So that's all about your part of the uterus. Now another one thing, the blood supply. You need to remember the blood supply of uterus. Okay, as this is uterus, so obviously it will get supplied by your uterine artery, the major blood supply given by your uterine artery. And as this uterus is adjacent to the ovary, right, this is ovary, so it will also get supplied by your ovarian artery also. Okay, ovarian artery. Now clinical concept, the last step is your clinical significance or clinical concepts. What things you need to remember if some woman will be having problem associated with uterus, like there is bleeding, or after menopause also bleeding happening. So the best management is the doctor done is hysterectomy. Hysterectomy means removal of this uterus. So hysterectomy. Now this hysterectomy means removal of uterus. Now this hysterectomy is different types, like total abdominal hysterectomy, and another one is subtotal hysterectomy. So what is the meaning of this total abdominal hysterectomy? When we are removing this uterus along with your cervix, then we will call it as total abdominal hysterectomy. When we are removing only uterus, then we will call it as subtotal hysterectomy. So that's all about your uterus. So what we have discussed from this uterus, this normal position of uterus is anteverted and anteflex. What is the meaning of anteverted and anteflex? We have discussed the weight of uterus in non-pregnant stage, pregnant stage, and puerperian stage, and capacity also you need to remember. The different part of the uterus like cornua, fundus, body of the uterus, isthmus. Okay, and what is about the living ligature? Like when woman gets pregnant, then the bulkiness of this uterus is getting increased. Not only the layer of the uterus, the myometrium portions, the outer, inner and middle fiber of the myometrium also get increased. And after the delivery of the baby, there is a tendency of getting PPH. So for preventing this, when the uterus gets contracted after the delivery of the baby, this myometrium also get contracted. So whatever blood vessels present in the myometrium, it also gets contracted, and then bleeding gets stopped. So this is called your living ligature. Now the different part like cornua, fundus of the uterus, body of the uterus, isthmus we have discussed. The blood supply, the major blood supply is uterine cavity and uterine artery and ovarian artery supplied the blood to the uterus. Then the clinical concept like hysterectomy, total abdominal hysterectomy and subtotal hysterectomy. So all we have discussed in this today's sessions. In the next part we will discuss the remaining two internal genital organs. So thank you.